Quality management. This is quality management and systematic monitoring. The policy is that TSI will develop and implement monitor activities and services offered in order to improve quality of each of our programs. It is also the policy to assure that clinical service is appropriate and that standards of services are being met. This plan will be reviewed minimum of one time annually. The procedure is the Director of Quality Control and Compliance or a designee is responsible for all quality improvement activities. The team leaders and supervisors may also assist with the quality management duties. The scope of services. Quality improvement plan is designed to monitor activities and services offered through TSI to ensure clinical services is appropriate and standards are being met. The program structure is data will be completed for quality improvement purposes at least one time a year. A minimum of 30 consumer files will be contacted through the year. Data from the quality improvement activities will be analyzed annually, and the results would be shared with the Vice President, President, and the Board of Directors. And once the data has been reviewed and a corrective action plan established, then staff would be presented with the data results. The goals of mechanisms for oversight is the outcomes and the outcome indicators. This is the collection of data through the Likert system 1 through 5 on follow-up questions in each area of the survey. There's acceptable thresholds with the acceptable thresholds for quality assurance improvement would be 80%, and the methodology of collecting data will be telephone surveys, written surveys, direct shadowing by the supervisor or designee. And the sample size is going to be at least 5 calls to consumers minimally quarterly. The evaluation and the corrective action plan. Any improvements that we need will be developed and in compliance with the will be brought to the attention of the Vice President and the President designee, and then the supervisor review the develop and make a corrective action plan. The corrective action plan will have specific guidelines for development and completion of the action steps, and the time frame should be the plan within 2 weeks. Staff titled responsible of the implementation of the action steps is the agency director, supervisors, and the provider. Expected outcomes, overall improvement area of the deficiency, education on the company policy, and discussion of ongoing corrective action situations should the issue not be resolved to satisfactory level. Improvement, steps taken to monitor the impact of the corrective action plan. Follow-up by the staff supervisor or agency director will ensure the plan is being adhered to and positive changes are being made. Documentation of the corrective action plan improvement plan will be placed on a disciplinary notice form for individual workers that utilize and address agency-wide deficits. The disciplinary notice form indicates where the plan has been implemented and completed and the effective to the action steps. Disciplinary actions can occur verbally, written, reassignment of cases, increased supervision or training, reduced caseload, suspension of employment without pay, demotion, and dismissal. Quality improvement activities. It is TSI's policy to collect and review data in order to assess ongoing implementation of the program, to identify strengths as well as opportunities for improvements. Now, the evaluation of the effectiveness of the QI program, ongoing review and tracking and trending of all incident reports. This could also see critical incident report policies and procedures. All incidents will be documented in the critical incident report, and that's our Appendix E. Upon completion of this form, it will be routed to the Director of Quality Control or the designee on that same day. The Director and the designee will assure that the incident report is routed to Magellan within 24 hours or other people that would need to know that an incident occurred. There are major incidents and minor incidents. Incident reports will be monitored annually. When found, trends and patterns will be reviewed, and treatment team will convey and address any needs that we have in our treatment modality. Ongoing reviews of consumer records, including service documentations, including the appropriateness of level of care and services. All files will be reviewed a minimum quarterly at the time of review. The consumer file checklist will be completed, and this is Appendix F. In addition to reviewing the files for completedness and accuracy, the file address for all consumers. All consumer sessions are documented on the documentation of billed services form. All the documentation notes will be turned in to the staff supervisor prior to billing. 10 case files will be monitored per month by the supervisor to ensure the quality compliance. The treatment plan must be completed on the 30th day after the case is opened. A review of the treatment will take place if needed within the first 6 months of the case being opened, as needed on an individual basis. At this point, the 6-month point, the plan will be reviewed and any modifications will be implemented. When plans are completed, they are turned to the supervisor for review on a multidisciplinary team. Plans are then reviewed for the quality and accurateness. After reviews, corrections are required and returned back within 5 days. Ongoing review of treatment plans to ensure that treatment plans are reviewed quarterly and that TSI does not use a standardized treatment plan because they are tailored and individualized to the consumer's single most effective need. Plans are reviewed to ensure they're individualized, restricted method as possible, and identify desired results. When a behavioral plan is developed, attention is given to written goals, objectives, and service activities that utilize the least restrictive method possible to obtain success. In addition, all treatment plan goals and objectives are written and to be time limited and outcome driven. Thus, treatment plan goals and objectives will be strength-based approach with proven evidence-based standards of practice to better facilitate chances of successful intervention to our clients. Now, part of our quality management is also ongoing review of personnel files. An annual review and conducted to ensure the evidence of background checks, required trainings, completion of job performance evaluations, and minimum qualifications for the job. Employment. Prior to being offered employment, employee curriculum are reviewed to determine that potential employee meets minimum position requirements. Once it is determined that educational experience requirements have been met, then the employee places a request for academic verification. Also, background checks are conducted for references. Ongoing review of responses to consumer stakeholders' appeals and grievances. So ongoing reviews and appeals and grievances will take place to ensure 1, a compliance with provider policy, 2, determine the need for systematic changes, and 3, distribution of appeals and grievances proceeding to our agency policy. In the event of a consumer appeal or grievance, the agency quality assurance department or the supervisor or staff involved would discuss and review the appeal to the and determine what agency changes must be made and any changes to policy or ongoing procedures that need to occur. The group will develop a strategy to modify the agency's policy. Ongoing review of presence of due process for rights and restrictions. It is TSI's policy not to utilize any forms of right restrictions with consumers we serve. Ongoing monitoring of health and safety needs as identified and addressed by individualized plans. Any identified consumer health and safety needs will be monitored and reviewed by each provider consumer session. Any concern noted will be addressed in the consumers and the family and the worker supervision. Ongoing review of person-centered planning requirements. Reviews of person-centered planning requirements will be conducted annually to ensure 1, consumer involvement is person-centered assessment, 2, development of an individualized plan, 3, ongoing monitor of the consumer's personal outcomes, 4, effectiveness of services, and 5, providers responsive to consumers' personal outcomes and needs. Consumer involvement in treatment planning, the development of individualized plan, and the monitoring the consumer outcome is conducted by the worker supervisor, the worker, the clinician who completes the assessment. This is done through the use of regular supervision meetings, review of treatment plans at the end of development, and at the clinical assessment. ongoing review of outcomes and rights and dignity to ensure the Director of Quality Control and Compliance and designee is responsible to review these activities. A review will be conducted utilizing the Magellan Health Service Treatment Record Review tool, which is Appendix G. The consumer achievement and outcomes provider support and consumer in achieving and outcomes. The agency conducts an annual policy and procedure review that assesses the effectiveness of all policies and makes determination where the needs and changes occur. At this time, consumer rights and dignity issues are reviewed, and any need for policy or procedure changes are made. Ongoing review of stakeholders and input from the satisfaction surveys and telephone surveys to ensure that our stakeholders' inputs are heard and are addressed. The agency utilizes staff satisfaction surveys to address concerns and agency development and change. Through the use of consumer releases of information, stakeholders are able to provide input related to consumer client satisfaction surveys. The agency utilizes DHS, case manager, other referral services to gather program feedback as well. Ongoing review of service documentation will ensure that our delivery of services are met within the definition of the Iowa Code. An ongoing review of medication management or administration to ensure that TSI does not administer or monitor any type of medication the consumer may be prescribed. The system is monitored by the Quality and Compliance Control Team. If an incident results in oversight of the QA or systematic monitoring program, the staff will have 5 working days to resolve the issue. And if it does not occur, then a disciplinary action may occur. Annually, and the Board of Directors will review the critical incident reports, and it will be documented in the meeting minutes. That is what we have for the quality management and systematic monitoring. I know that's a handful, and pretty much it's all the QA, quality assurance stuff the department, our QA department handles. But I wanted you to make sure that you understood some of the things that we utilize into monitoring the effectiveness of all of our programs. And it's very important that we do this. Because we do telephone surveys and we want to be in 100% compliance. However, we do have a lot of services and a lot of people, so we need to at least maintain an 80% compliance, or we'll have a corrective action plan at that time. This can be based on many things within the agency that we need to maintain quality compliance. So that's why we go ahead and utilize the quality management and systematic monitoring.